Hello, everyone. Welcome to the training session on ethical issues and conflict in mental health and wellness. This presentation will address common ethical principles and potential dilemmas and offer strategies for resolving conflict within the context of mental health practice. Let us begin. My name is Christopher Pickney. I am pleased to guide you through this discussion tailored to undergraduate students. As we delve into the complexities of mental health and wellness, we will explore the ethical challenges and conflicts in this field. These include navigating dilemmas, addressing conflict of interest, and ensuring we uphold the highest standard of integrity and care. This discussion will equip you with practical knowledge and tools to effectively recognize and address ethical issues. Together, we aim to foster a deeper understanding of how ethical considerations impact mental health practices and personal decision making, empowering you to navigate these challenges confidently. Thank you for joining us today for this critical discussion. Let us embark on this journey to enhance uh, our ethical awareness and strengthen our ability to contribute meaningfully to mental health and wellness. Ethical standards are fundamental for mental health and wellness professionals to ensure the welfare and rights of clients maintain professionalism and preserve trust within the therapeutic relationship. These standards guide decision making, promote confidentiality, and establish boundaries that support a respectful and effective care environment. In this presentation, we will explore core ethical principles in the mental health and wellness field, conflict of interest, and personal values in decision making, and ethical dilemmas that will arise when working with clients and how to navigate them. By examining these topics, you will understand how ethical standards shape practice and decision making in mental health care, ensuring clients' well being is always prioritized. One common conflict of interest in mental health is dual relationships, which occur when the therapist holds multiple roles with the client. For example, a therapist might work with a close friend or family member. This situation can create bias, impair objectivity, and blur professional boundaries. To resolve this, the therapist should avoid dual relationships whenever possible, establish clear professional boundaries, and, if necessary, refer the client to another, not personally involved professional. Another conflict of interest arises when financial incentive influence a therapist's recommendations. For instance, a therapist might receive a compensation suggesting certain treatment or products to client. This can undermine trust in the therapeutic relationship and affect the therapist's objectivity. To prevent this, therapists should be transparent with clients, strictly adhere to the professional ethical code, and refer clients to unbiased professionals when financial conflicts occur. Sometimes a therapist's value may conflict with their professional decision making. For example, if a therapist holds strong personal belief about substance, bu- substance use, it might affect how they approach a client treatment choices. In these situations, Therapists must self-respect, seek supervision, and prioritize a client's anatomy and well-being. Resolving these conflicts requires putting these personal biases and ensuring that decisions are centered on what is best for the client. Let's now review the core ethical principles that guide mental health practices. The principles of anatomy emphasizes the the importance of respecting clients' ability to make informed decisions. Beneficence, beneficence involves promoting clients' well-being, while non-malfeasance focus on avoiding harm. Justice ensures fairness and equality in treatment, and confidentiality protects the privacy of sensitive information. Integrity involves maintaining honesty and professionalism in all aspects of practice. These principles form the foundation of ethical decision making in mental health. An ethical dilemma often arises when confidentiality must be balanced with client safety. For example, if a client discloses suicidal thoughts, but confidentiality agreements prevent sharing this information with family, the therapist faces a difficult decision. In such case, the therapist must prioritize safety while maintaining confidentiality as much as possible. It is essential to discuss the limits of confidentiality with the client upfront, involve family when necessary, and seek guidance from supervisor or colleagues to make informed ethical decisions. Another, another dilemma arises when cultural practices conflict with professional ethical standards. For example, some cultures emphasize that involvement of family members in therapy, while professional ethics prioritize respecting a client's anatomy. In these situations, the therapist must exercise cultural competence, which means understanding and respecting the client's cultural values. It may involve open discussion with the client, exploring culturally appropriate solutions, and consulting with cultural experts or supervisors to ensure that the cultural values and professional ethics are honored. When faced with ethical dilemmas, there are key steps to follow to navigate them effectively. First, identify the conflicting ethical principles at play. Send the ethical guidelines from the ACA and the NAPA and NASW will be reviewed. Reflect on personal values and potential biases and seek guidance from supervisor or colleagues when necessary. Ultimately, the therapist's responsibility is to prioritize the client's well being while making informed ethical decisions that adhere to professional standards. In conclusion, ethical decision making is essential for providing high quality, trustworthy care to clients. Adhering to professional ethical codes safeguards client rights and ensure the integrity of the therapeutic relationship. Mental health professionals must engage in ongoing self reflection develop cultural competence, and seek collaboration with others to navigate complex ethical dilemmas. By doing so, we uphold the trust and well being of our clients. Thank you.